Technology in dentistry is something that is just constantly changing, and that's one of the things that's really exciting about it. Not just that it's, flashy and cool, but that it also helps us to do really good, high quality care for patients. Some of the things that we have here are the Cerec machine, which is CAD/CAM technology, and we're able to scan a patient's tooth, design digitally a restoration for them, mill it out, fire it in the furnace, and cement it on same day. So it's a real big convenience for the patient. And it also allows us to take complete control of that process. The iTero scanner is an intraoral scanner that we can use to scan the entire patient's mouth in about 5 minutes. We can do Invisalign with a high degree of accuracy. We can make digital models, we can make night guards, all sorts of things in office. And it's a fast, easy way with no goop impression. Patients love it. So we can 3D print here in the office. We have a medical grade 3D printer. It's really accurate. It can print down to 50 microns accuracy, which is really tiny. And it also acts as like a go-between between the digital world and the physical world. So we can design something digitally and then print it out and then put it in the patient's mouth. One of the really cool things that we have here is the digital smile design. So we can superimpose a patient's 2D photograph with a 3D scan of their jaw, and then we can digitally redesign their smile, make it photorealistic so we can look at it with the patient and tweak things as we want to. And once we're happy, we can actually 3D print a model of what we just designed and then basically try it in the patient's mouth. Which is just a really amazing thing to be able to do. We love to use our intraoral cameras to do our examinations. It's a big part of our new patient exam where we take a picture of every tooth in the patient's mouth and we can blow it up 100 times, which is really big magnification. And that's helpful because it helps us to diagnose a lot better. We can see fractures and defective restorations in the patient's mouth, but it's also so helpful to communicate to the patient that they can see exactly what we're seeing. And so there's just a really amazing dialogue that you can have with the patient when they can see you and trust that what you're saying is really there.